On this episode of Plastic Surgery Uncensored, I'm going to be going through a lot of your questions that you guys have sent in over the last few weeks and go ahead and try to give you a little bit of insight as to my thoughts. So listen in to this segment of Plastic Surgery Uncensored. Who knows, your questions may be answered. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. Today we have a co-host, my producer, Maria, who doesn't even want to be seen on camera. So if you guys see us on YouTube, you get to check her out. She's very shy. But Maria and I are today, what we're going to do is a little bit of a Q&A. What we try to do every so often is open it up to questions, and people write in to us regarding sort of their burning questions. And I like to, every once in a while, have an episode where we just try to answer them candidly. So what we're going to do today, and listen up to see if maybe one of your questions are being asked, is kind of fly through a bunch of questions, and hopefully you'll find one of them maybe interesting or something you were thinking. So Maria, what are our questions today?
Okay, Dr. Rady. Our first question is from poison.oki.
We love these, by the way. These names are awesome.
I don't know where they get them.
Whoever you are, that's awesome.
That's a good name. It's about breast reductions. What's the smallest you can go?
Okay, so as you always know, I'm a long-winded guy. Long-winded why? Because I like to make context and kind of explain things. So the question, what it really means is that ultimately people seeking a breast reduction have had it. They're kind of over it. They've had large breasts. They're usually very heavy. They're pendulous. They hurt their backs. They can't wear clothes. And so I often have patients coming in and be like, I want them off. I want a size B. So the question is, they often ask is, how small can I make them? Well, in theory, you can make them as small as you want. Theoretically, you can do a mastectomy. I mean, you can keep whittling down breasts, aka removing breast tissue, till you have none. The problem in the right question, and we did this in another segment, is not just so much how small can they be, but rather how small can they be and still look pretty. And when you throw in the word pretty, aka round and full and projecting, then you do have a limit, because breasts are a geometric configuration. They are a sphere, and everybody's breast has a certain width. And in order for you to have a round breast on that width, there's a limit to how small you can make it. So for example, if you have a really wide chest, right? Your breast starts in the middle of your breasts start in the middle of your chest and end by your armpit. If I want to make you a B, then I got to make you very flat. So to answer your question, you can make your breasts as small as you like, but not necessarily pretty. If you want them to be pretty, then there is a limit to how small you can make them. Hopefully that answered your question.
No, that was good.
Okay.
And you don't talk extra. You give the right information.
Yeah, all right, good. See, that's when your producer's got to make you feel good about yourself.
Yes. Okay, so the next one comes from Family Harris. Who is a good candidate for filler nose job versus surgical nose job?
It's a great question. So, there's the sort of non-surgical and surgical approach to aesthetics. And obviously, if one can get an amazing outcome doing a non-surgical approach, which means what? No surgery, no anesthesia, limited downtime, theoretically lower risks and lower costs. Awesome. That'd be amazing. Like, why not? Because surgery isn't for everyone and it has a whole host of sort of exchanges. But I'm a firm believer that each of them serves a very defined purpose. And you seldom, if ever, get the same kind of result from a non-surgical approach than the same with a surgical approach. So liquid rhinoplasty or non-surgical rhinoplasty is essentially taking a filler, and I would caution you, all fillers are not created equal in the nose. You can't just use any filler. I've had so many people show up with catastrophic outcomes with crappy filler. You want a very thin substance, something like a Restylane inside the nose, because it doesn't have the same expansibility than, let's say, a lip or a cheek. So you're taking a filler and filling the nose. You're adding to the nose. So by definition, number one, you can't make the nose smaller. You can give the illusion the nose looks smaller. So what you're doing is you're adding filler in areas that make the nose shape more balanced and less angled.
It's more pleasing to the
Right.
eye.
So the number one place where liquid rhino is amazing is for people that have a small hump, and you add the filler to the area in front of the hump, whereas the takeoff of your nose, and make the nose higher but straighter. So you add to the nose and give the illusion that the nose is straight and you have no hump. In that instance, it's awesome. You can also add a little bit of filler to the side of the nose in people whose nose is a little crooked, and it gives the illusion that the nose is straighter. You can also add a little bit of filler to the tip of the nose and make it look a little smaller and maybe rotated. Again, you notice I keep saying a little here, a little there. But if you have a big downturned hooked nose that's bulbous and wide, it's not an option. Yet you'll go to a spa and the nurse injector or whoever will be like, yeah. Because again, if the only thing I have to offer you is a hammer, then it doesn't matter that you're a screw. I'm still going to try to hammer you in. So you have to be cautious and know that you're going to be sold on these things. Liquid rhino is very limited in what it can do. And at the end of the day, I would say that the majority of patients with a sizable type nose really needs to go down the surgical route.
So basically it's a case-by-case basis.
Right. Yeah. People often ask me, well, I don't want a
There's
rhinoplasty.
no black and white
I just
answer.
want a liquid rhino, as if they're interchangeable. And that's not the case.
It should come from the doctor.
Well, it should come from an honest doctor.
An expert in rhinoplasty.
Honest expert.
An honest expert.
Yeah.
That's a good point. An honest expert.
Okay.
Okay. The next question is from Myra Isabel. The future of plastic surgery. Anything to look forward?
I think that's really interesting. I think that while there are lots and lots and lots of advances in all areas of technology, medicine is no different. I mean, we're doing robotic surgery. We're doing nano therapy with chemotherapy. We're doing face transplant. There's so much cool stuff on the horizon. I think I think plastic surgery, the actual art of cutting and closing and resealing, is always going to be the same. The tools may change, but the principles are the same. And so people are always looking for like the newest, hottest thing. And what I've come to realize is that they're usually gimmicky, tend to leave very disappointing results that don't last, and at the end, mostly marketing driven. So I'll take liposuction, for example. Liposuction is the process in which we use a large metal straw and remove fat in little clumps. Correct? Mm-hmm. Over the last 15 years, they've come up with 30 different names for it. Laser lipo, slim lipo, ultrasound lipo, vaser lipo, tickle me lipo, blah, 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 blah. The truth is, people will argue otherwise, but the gist of it is the same, and the problems with it are still the same. So what we find is that most of what's advanced in plastic surgery tends to be the name. Mini facelift, this kind of facelift. There isn't not advances, but I would caution you that most advances are not as beneficial as you think, and most of the truth and the gains are tried and true. So yes, there will always be advances, perhaps in fat grafting and the survivability of fat, in the materials we use, in the medications we give, and how we help you heal. But the actual art of cutting and rearranging the stomach or the breast, I don't think is going to change for many eons to come.
Okay, good response. Okay, so the next one is from Lulu Hakim, 86. What do you do if you develop scar tissue post-rhinoplasty? Where do you develop scar tissue?
First of all, why is rhinoplasty so challenging? Because unlike other areas, the nose is very unforgiving when you do surgery. A lot of surgeons just totally throw in the towel when it comes to rhinoplasty. They just give in because, whereas you do a breast aug or a tummy tuck, the anatomy is very favorable. It goes along. It's cooperative. Noses are very uncooperative. You operate on them and there's a lot of swelling afterwards. The swelling changes the shape of the nose. If you have oily, thick skin, like many Latinos or Asians or African Americans, you do all these fancy things to the cartilage and the bone, and then you put the skin back and the skin does whatever the hell it wants. So for a lot of people, rhinoplasty is very frustrating because it's a wild horse. It doesn't do what you ask it to do. So in certain types of patients, the nose tends to create swelling that may last a very long time or forever and create scar tissue. And the area most common is in what's called the supratip. The supratip means supra, above, tip means the nose. So the area above the nose, it creates a little fullness that looks like your nose is downward turning. And the truth is there's not a lot of things you can do. A lot of surgeons will inject you with steroid, and the goal with steroid would be to break up the scar tissue, but you have to be careful because steroid has other issues with it. So I would say one of the hopes is to avoid creating the scar tissue in the first place. And while you can't always avoid it. Definitely, the more skill you do the surgery with, the less swelling there is, although some noses will always swell. And then postoperatively, you want to maybe use a little steroid and taping, but it's definitely a challenging part of rhinoplasty. You kind of can't escape it.
But didn't you say at one point that it takes a while for the swelling to go down? So would you do it right away?
Very good point.
You have to wait a year or 2 years?
Yeah, so great point. Like, unlike you do breast surgery, and you could pretty much figure out what's going on with the breast within 3 months. Facelift, pretty much within a month. Rhinoplasty, it would be the equivalent of tasting a souffle like 3.5 minutes after it's being cooked. You won't know nothing about a nose for 6 months. And so anybody who knows anything about noses would tell you, you got to wait at least a year before you do anything. Now, don't get me wrong. If your nose is hideous after surgery and it looks crooked after 2 weeks, waiting a year is not going to change anything. But definitely, if it looks good or pretty good, but it's not great because it's still swollen, you got to give it time for sure. And you got to wait and you got to be patient and not get frantic and start trying to do a bunch of things and do a revision of a revision. So yes, you're good point. You got to wait.
See, I listen to your podcast.
Good job. Okay.
I'm not sitting here just taking time.
You're just not a pretty face behind a computer.
Yeah. Anyway, so Lernick Shervanian asks, breast reduction, lift, and future breastfeeding, is it going to cause any problems? Which is a good point. I get a lot of women asking me this as well.
Why are they asking you?
Because they know I do these podcasts with
you. You're an expert now by association. I like that. That's good.
No, I just tell them to listen to the podcast.
Just listen in. Good. So when you do a breast lift or a breast reduction, the majority, 90% of the techniques use separating the breast tissue and gland, rearranging them and resuturing them together to create the new shape, whether that be reduce the amount of breast tissue or lift and reshapen it. They pretty much have to fillet the breast open and reconnect it. In doing so, what happens is your gland, your breast tissue, has all these ducts or plumbing pipes that bring milk to the nipple exit. So imagine you have this underground network of pipes and they all coalesce at the nipple. And when you get pregnant, they get swollen and make milk, and that milk follows these pipes out to your nipple. So any procedure you have whereby which you disconnect and rearrange the ducts will for certain affect the ability to breastfeed. They do not reconnect ever. Your breast tissue will heal and you'll be fine, but those pipes don't reconnect. So it all depends on how big a breast you had to begin with, how much breast tissue was removed, and your likelihood of making or how much breast milk you make. So the long and short of it is absolutely it will affect your milk production, but whether or not you'll be able to breastfeed will really depend case by case. If it is tantamount that you breastfeed, like it's like you must, then you want to avoid those procedures. If you are open to breastfeeding but maybe not making a lot of milk, you can take it into consideration.
Okay, so it's almost recommended not to do any type of procedure regarding reduction or lifting until after you've given birth, no?
Yeah, I mean,
to avoid the possibility.
Because for a lot of women, like you're 20 years old, you don't plan on having kids till you're 33, and that's 13 years of being unhappy, and then who knows what's going to happen to you. So that's a heavy statement to say, but occasionally I'll have a woman who's 30, about to have children, and then she's worried about it, and I'm like, well, then you might as well just wait till you have kids. Breast augmentation's a whole different story, but breast lifts and reduction for sure.
Okay. But at 19, 18, you might not be thinking about breastfeeding and might not be a big issue for you. Okay, the next one is live fast, die pretty.
Ooh, I like that. Live fast, die pretty.
Yeah. How often do clients go into body shock after surgery? I've never heard of this, but
okay, so that's one of those urban legend folklores. Those are the things that are passed around from friends to friends that actually have no real shock. I'm assuming is like when your body can't tolerate, you're hemorrhaging, or you're people always use the lay person says, can you tolerate that many procedures? Let's say I do a mommy makeover, breast lift, breast implant, tummy tuck, and lipo. On average in my operating room, because I'm pretty particular and detail oriented, do everything myself, that could take 8 hours. Okay. Oh my God, can your body handle that? Aren't you going to go into shock? What is that? Shock what? What does that mean? Of course your body can handle that. First and foremost, shock is when you lose so much blood that your body can't stay, your blood vessels can't stay afloat and your blood pressure drops. With plastic surgery, you have very little to no blood loss. If you're hemorrhaging from plastic surgery, we got a major problem. You lose more blood loss during a knee replacement or a cardiac valve replacement or giving birth than you do plastic surgery. It's very controlled and shouldn't have a lot of blood loss. That takes care of that. You don't operate on people that are sick. You operate on people that are healthy. I didn't say young or old. I said sick. So you can be a 74-year-old person who's super healthy and be totally fine. And you could be a 33-year-old person with like horrific diabetes and already have coronary artery disease. So if you're unhealthy, you're not going to operate on them. But people don't go into shock from surgery. They go into shock from hemorrhaging or an allergic reaction or whatever. So the two have nothing to do with each other. And no, I've never had that happen to me. And I don't anticipate that ever happening. So the answer is no.
Okay, when we come back, I want to ask you a question regarding tummy tucks and if they can define your abs. Let's do that after the break.
Okay, let's come back. Listen, guys, tune in. We'll be back to Plastic Surgery Uncensored. All right, welcome back from the break. We're here, Plastic Surgery Uncensored, and I'm with my producer, Maria. And what we're doing is we're going through your questions that you guys sent in and answering them and listen up and see if one of your questions are being asked. So who's the next one, Maria? You said something about tummy tucks, etching. What was it?
Right. Well, this one I'm really curious about. You know, you can tell the ones that I like, but it comes from Shayad Lauren. Can a tummy tuck give you more defined abs?
Okay, so this is a really good information. So let's go about this. First and foremost, let's define tummy tucks and high-def lipo because they're totally different. High-def lipo is you take someone's abdomen, it's just the way it is, and you suck out fat at a high level, very close to the skin, and you try to mimic and make fake abs. Okay, so you do that in someone who doesn't have loose skin and had 5 births, and you do that in someone who has tight skin and some fat, and then your surgeon will take a liposuction cannula and kind of like etch in the space between abs. So I don't do that procedure. I'm not a fan of it. I'm not going to get into that. It's too convoluted for the purpose of this question. But that's high-def lipo, and that creates fake abs. Tummy tuck is a procedure in which a surgeon makes a large incision at the bottom of your abdomen from which they remove excess skin, because I've had 3 kids, I've lost 100 pounds, etc., and they tighten often the muscles that have separated with pregnancy, thereby flattening your abdomen and tightening the skin. Those are 2 different things. Now, obviously, if you do high-def lipo, you could theoretically create abs, whether they look real or look fake. I mean, I'm not a huge fan, but okay, fine. That creates fake abs. If a person has really good musculature, they're super fit, which I have tons of moms that are super fit, but have a bunch of loose skin that's thin. I have seen many women after a tummy tuck and muscle correction have ripped abs. Why? Because imagine you have these abs and then you tighten the skin over it, and then now you create a really tight envelope, and then all of a sudden your abs start to show underneath. When you are fit and you have loose skin, you're never going to see the abs. I don't care if you do crunches, 5,000 of them a day, you're going to have the most amazing abs, but they're hidden under the mess of your skin. So you get a lot of abs if you have them, but then they show up because imagine you tighten the skin over those abs. One thing you don't want to do is you don't want to do a tummy tuck and at the same time of your tummy tuck, try to create high-def abs in the abdominal skin that you're tightening. Very, very risky. If you liposuction your abdomen during a tummy tuck, you could kill or lose the skin of your abdomen. There are guys that sometimes push the envelope, but I would caution you, don't mix gas and oil.
When you say lose the skin, what do you mean?
It dies. It turns gangrene.
Wow.
I said gas and oil. That was a mistake. It's gas and fire. But yes, the skin dies. Dead. Finished. So lipo, tummy tucks, and that's how you get the abs.
That's a scary thought, by the way.
Well, you got to talk about it.
Yeah. Okay. The next one is it's Lauren Sanders. Can you get fat grafting to your face as an alternative to fillers?
Great question. So fat grafting is not a new phenomenon, but it's a relatively new phenomenon. What it entails is we take fat from somewhere, often your abdomen, your inner thighs, your love handles. We prep it, and there are many different ways that doctors prep it. Sometimes they just literally take it out and put it on a gauze and then reinsert it. Sometimes they centrifuge it in a centrifuge. Sometimes they wash it. Sometimes they add other things to it, but they prep it. Then they put it in syringes of different sizes, and then they re-inject that fat back into your body. That is fat grafting. Again, remove fat, prepare it, and re-inject it. That fat can be added anywhere in your body that you think that you need volume, because you're adding volume. Common places today are the face, the breasts, and the butt. When added to the butt, it's called a Brazilian butt lift. We had many segments on this, mostly highlighting the dangers. Not that you couldn't do it, but be cautious because there's been a lot of deaths due to that procedure, but it's added to the butt, Brazilian butt lift. It can be added to the breast. Again, I'm not a huge fan, and I'll explain in another segment. And certainly can be added to the face. When it's added to the face, it would be in lieu of or in addition to fillers. The benefits of fat, and there are many disadvantages. The benefits would be that it's potentially permanent. Why potentially? Because some of the fat you inject will get absorbed by your body. Because the average fat survival is 25 to 75%. I mean, that's massive. That means 25 to 75% of the fat that I put in dies or reverse stays. So some of it for sure stays. So that's permanent. You don't have to keep doing it. The other advantage is that it's so-called natural, and theoretically it's unlimited. The downside, which every procedure has, is that it's permanent. So if you hate it, you're screwed because it's staying. It's not going anywhere. It's alive, which means there are many cases where people gained like 50 pounds in their lives. So they get this done when they're 30, and then all of a sudden they get in their age older and they gain 45 pounds. And the areas they injected fat, like in their lips or under their eyes, puff up like a balloon. Remember, those fat cells still have the memory of where they were borrowed from. And last but not least...
That's a scary thought that you'd gain fat in your face.
Where you inject it. And you don't gain it like your face gets fat. You get lumps where those... And the last thing is they're lumpy bumpy. Fat is very hard to work with. That's even worse. It gets irregular, whereas filler is smooth. The beauty of filler is it's temporary. You can reverse it, but again, you got to keep doing it. So you can definitely inject fat in your face in lieu of filler, but you have to be very careful, and it has to be done by a very skilled person. And my recommendation is be conservative, because you can always go back and add fat, but once it's in there, you own it. It's not like filler where you're like, oh crap, I don't like that, and then you can get rid of it. It's there.
Now, how about plasma? I've heard of people injecting plasma. That's not permanent.
No. So plasma is this new thing that's controversial because I think some of it is gimmick, some of it is real. What they do with plasma is they take your blood, they spin it, they prepare it, and then they mix it with stuff. And the plasma is still very early science, and it has a lot of like primordial cells that are potential that are supposed to be like rejuvenating. So what they do is they do facials with it. That's called the vampire facelift. Vampire facelift or vampire facials.
I think Kim Kardashian first showed this.
I mean, who knows? Well, she does
in an episode.
So what you do is basically whatever we do, you add the plasma to it to make it like super duper. So if you're going to do a facelift, you inject with plasma. If you're going to do a facial, you inject the plasma. If you're going to do fat transfer, you inject the plasma. And the idea is that the plasma supercharges the results. There is a lot of mixed data about plasma. People are doing it in orthopedics like it's like the holy grail and injecting it in all kinds of joints. And it's a lot of controversy because it's very expensive and we don't have good science. So careful.
Yeah. Okay, this one comes from Lopez Rincon. Can you have a tummy tuck and a BBL at the same time? I don't know what a BBL is.
Brazilian butt lift.
Oh.
Great question. So the answer is yes, but the second question is may not be ideal. So a tummy tuck is in the front. A BBL is a Brazilian butt lift, whereby which we take fat from all over donor sites and inject it in the butt to make it fuller, rounder, and lifted. Everyone kind of knows my stance on BBL, but I'll say it again. BBL is a good procedure in the right patients when done correctly and very cautiously. So that means, as I said, a very limited subset of people I think are good candidates. I think the overwhelming majority of people are having bad outcomes, and we talk about another segment. But in order for your BBL to have a great outcome, the ideal recovery is that you lay on your stomach for about 2 weeks. The The fat that you inject needs to survive and the blood supply needs to get in there. So imagine you do all this fat and inject it in your butt and then you go and you lay on it or sit on it. So the right answer for your optimizing your recovery is to lay on your stomach. Now you do a tummy tuck. A tummy tuck is where we do all this very intensive work on your abdomen. In order for your tummy tuck to survive and have a great outcome, you got to lay on your back. Do the homework.
Yeah, I was thinking, that was the first thing I was thinking. Is,
so the reality is
how do you sleep on your side?
So something is going to be compromised.
Right. Yeah.
So you won't get the best outcome in one of them. So I don't generally suggest it. That's why.
I'm thinking about the pain.
Pain is, listen, let me, this
you
wasn't
come out of it after doing
people
a tummy
say this,
tuck and then you know.
Let me tell you something. People say this all the time. It's not a question, but can your body tolerate the pain? Pain is not additive. Listen carefully. Pain is not additive. What does that mean? Tummy tuck is an 8 out of 10. BBL is a 7 out of 10. Your rhinoplasty is a 4 out of 10. So that means if you do all three procedures, 7 and 8 is 15, 15 and 4 is 19. Holy crap. No. Your body recognizes the highest amount of pain it has in period. It doesn't know the other things. There is no, it's 10. That's it. So as a matter of fact, it is ideal to get that crap over with safely in the right environment. Then your body isn't going to add this crap up. Do you know how much pain you're in when you get into a car accident and break your pelvis, shatter your ribs, destroy your fibula, and smash your jaw? Do you know how much pain you're in when you do a liver transplant? These are the sickest people on earth. Pain is pain. When you're in pain, your body doesn't know crap from crap. So that's all you really need to know.
I never thought of it that way. The next one is Abolts 001. Can a belly button scar after a tummy tuck be fixed or made less visible?
So belly buttons are the sort of, if you will, the telltale sign of any tummy tuck, right? An ugly, hideous, I'm a tummy tuck snob. There are a lot of things about tummy tucks that make it from to wow. One of them, of course, is how low the scar is, how good the scar is, etc. But most everything that makes a tummy tuck terrible can almost be hidden, except for your belly button. So one of the worst things that can happen to you is have a really high scar, like your scar is like too high. So what do you do to conceal that? You wear ugly midriff, high-riding underwear or bathing suit. You can technically hide it, but you can't hide your belly button unless you wear one piece. Well, then what the hell did you do all that for? So your belly button's out there for everyone to see. Your mother-in-law, your nosy cousin, everyone sees it. Once you have an ugly belly button, it's very hard to almost impossible to correct.
So get it right the first time.
Very important you get it right the first time. Why? Because the hole's already made and whatever. What makes a belly button look ugly versus look natural? When you are young and your body is fit, your belly button is usually a pretty tight innie. You have a nice tight stalk. You have an inverted a hole, and your skin is attached to it, and it creates a sort of a shadow. Most tummy tuck belly buttons are round, not oval, at the skin surface, meaning like a sticker. They're not pulled in, and very large. So they look really odd. So you have to make sure that when you do your homework, your surgeon reproducibly, their results have nice belly buttons, because it's very hard to fix.
So that's something you want to see pictures from.
Yeah, you should be looking. I mean, plastic surgery is amazing in that you could Photoshop your pictures, but it's not a colonoscopy where you don't know. I mean, it's all out there.
Right. Yeah. And this is our final question.
Last question.
Justin, 85. Is it possible to do breast lift with fat transfer instead of implants?
Okay, so it goes back to the fat transfer thing that we talked about. Yes, fat transfer can be done for volume added to many areas. The three most common is the face, the breast, and the butt. I'm not a huge fan of fat transfer to the breast, although it sounds very good. Why? Because the alternative is adding an implant, and nobody really wants an implant. It's a foreign material. It has to be replaced. It can break, blah, blah, blah. It does an amazing job in the breast because you're not sitting on your breast like your butt. The problem with fat transfer to the breast, number one, is it takes a lot of fat to make an appreciable difference. Number two, a lot of the fat disappears in the breast as it does, more so than other areas. And number three, when you do a breast lift, you're rearranging the breast and the blood supply to the breast. Then when you do a fat transfer, you're injecting the breast with tons of fat. And I think that the risk of losing your nipple or blood supply issues go up pretty high. When you're doing a breast augmentation, which is your breast has good shape, it just needs to be larger, it's a little less risky. And maybe for a breast augmentation and you're a B cup and you want to be a full B, maybe it's okay. But to have a really nice outcome with a breast lift, you need some high volume to create that youth and that roundness. And I don't think you're going to get it from a breast lift with fat transfer. It's very organic and you're like, oh, but I avoid the implant. I think you're going to be underwhelmed, and I think your result is going to be mediocre.
And if you gain weight, won't it get lumpy, like you said?
It won't get lumpy because the breast is very camouflaging, but it will grow because you're gaining. Let's say it's belly fat. The belly fat's going to change when you gain weight. So fat's alive. It changes. That's not my main concern, but that is one of my main concerns with the face.
Yeah. Well, I think that's it. I thought it was very informative, and if our listeners have more questions, they should write in to send their recommendations and their questions to your Instagram.
Right. So listen, you can see that we love to answer your questions. So what I would suggest is send us your questions. We have a lot of platforms. You can find us on Facebook. You can find us on Instagram at Dr. Rady Rahban, at our handle RADYRAHBN. Of course, you can always send it in your. We love reviews, positive ones.
But they can also send questions there when they send the reviews as well.
So send them and then look for your questions. You'll make them. Anyways, it was a pleasure. Thank you, Maria, for getting in front of the camera instead of behind the camera, or in this instance, the mic. And it was a great episode. And thank you so much, everybody, for tuning into Plastic Surgery Uncensored. We truly appreciate you guys, A, listening, B, sharing with your friends, subscribing, and most importantly, download. Because at the end of the day, we do this for you guys. So I look forward to the next episode of Plastic Surgery Uncensored.